Thank you so much, Julie, for that introduction. We are very, very honored to be here leading this patient panel today, and we're especially excited to be following the really great presentation by Dr. Stacey Arnold, as it leads so well into this discussion. If we could just have our two panelists, Sarah and Mario, please introduce themselves and tell us a little bit about themselves. That would be great.
Ladies first, Sarah.
Hi, you guys, and I just want to say thank you for having me on today. It's a real honor to just be here and talk about, what's going on, especially with COVID and everything. So I just wanted to say that I'm just glad to be here and be with you guys. And so my name is Sarah, and I'm from Minneapolis, Minnesota, and I am 34 years old. And I've been diagnosed with PNH and aplastic anemia for about 6 years now, this month in October. So, and my background a little bit is my degree is in psychology, and I wanted to go to school for marriage and family therapy. So I got a master's degree in that. And so basically that's a little bit about myself.
Awesome. Thank you so much.
Sure.
Mario, how about you?
Sure. Hi, my name is Mario, and I was diagnosed with severe aplastic anemia 13 years ago, almost to the day, actually, 2007. Sarah's story is very similar, just in terms of being diagnosed, not having any symptoms prior to. Unfortunately, when it hit hard. Presently, I'm doing well. I'm off of all medication. I'm, having the equivalent to remission or robust recovery. Things are going great. I follow up twice a year with my local doctor here in New Jersey. I misspoken not to say I'm based out of New Jersey, and I am re-enrolled in a clinical trial with NIH. So every 3 years I do follow up with them. When I was diagnosed, I was treated primarily at NIH and locally at the Cancer Institute in New Jersey, and they currently still work closely together. So that's a little tidbit of my story there.
Awesome. Thank you guys so much for being here with us today. So Taylor and I have prepared some questions and talking points, but we really do want to encourage the audience today, if they have any questions, to go ahead and put it in that Q&A conversation, and we'll see if we can get the panelists to address some of those as well. Taylor, do you want to start?
Sure. So I know you guys have already addressed bringing up COVID, but one thing I do want to bring up is isolation. During treatment and going through treatment, isolation is an issue. Can you talk a little bit about what it's like being isolated from your peers and family when you're going through treatment, and if you were isolated because of that? And is that different than being isolated because of COVID? And then can you talk about the differences or the similarities?
Sure. Who wants to go first?
I'll default to you, Sarah. Go for it.
Okay, sure. So the way I view things, at least right now, I would say the world is kind of getting a taste of what it's like for a patient to be a patient, essentially, these last several months. Excuse me. Being in isolation, being away from, your family and friends, having issues with things like depression and anxiety, having financial difficulties, all of that is kind of what I would say what a normal patient would typically go through on a kind of a daily basis, I would say. And Mario, you can agree with me on that too. I would think some of that is, that you've experienced some of that as well. But also with COVID, it's an extra layer of, you have to be more mindful of your specific disease and being extra cautious about saying, hey, I really shouldn't be going to these places, or I really need to be more diligent about wearing a mask, or I would really like to go to this, let's say, birthday party, but I can't because I have an anxiety about who might be there or where they might have been. So there's a lot of different layers, I would say, and especially it's more complicated if you've been treated in a hospital recently, because again, you're limited to your support system as far as visitors. So that can definitely take a toll on you mentally as well as physically when you're being treated as well. So those are just a few points that I wanted to mention.
Mm-hmm.
Yeah, I agree 100%. Being a patient and the seriousness of the disease, unfortunately, part of the process, at least for me, was the isolation. I was treated with horse ATG. Post horse ATG treatment, not only did I experience the serum sickness, but then I also developed a aspergillosis in my lungs. It's a mold that most definitely it influenced me being isolated, not only in the hospital, but when I was home, because of the nature of the disease, our counts being low, being prone to infection, things of that nature. So pre-COVID and post-recovery from aplastic anemia, it was the norm. Coping with it and dealing with it, like Sarah was saying, it can take its toll on you. But you find your way. And in terms of the whole pandemic that's happening now, the seriousness is, I'm fortunate, my counts are within the normal range. That doesn't exclude me from not being careful. Unfortunately, I did develop, I tested positive for COVID, and I'm on the road to recovery. Everything is fine. Still being diligent with, living this new lifestyle with this pandemic happening. I had to isolate myself, and it's funny because I just got over it a week ago today, and it actually brought me back to my days of my recovery of aplastic anemia. So even though it's 13 years removed, it took me right back to that moment where I was like, oh, been here, done that, and it stinks no matter how you slice it and dice it. But, it's necessary. So, that's just part of the process.
Well, speaking of the kind of right when you were first diagnosed, and especially that severe infection that you developed, from your diagnosis and through your treatment, what side effects from your disease or from your treatment have you had, and which one of those have really significantly impacted what's been going on with your lives?
I would say for me, when I was first diagnosed, one of the main factors, side effects, was fatigue, just from being sick, even before I knew what was going on. And I had severe bruising, all over my body, and I had just thought it was low iron count. And then with the treatments that I had had, like Mario had said, I had had 2 rounds of ATG right when I was first diagnosed, one right after the other, because the first round was unsuccessful. So I had the serum sickness as well, and that was completely terrifying at the time, and took a long time for me to recover from that. So I had had several, just from the medications, I had had, mouth sores, I had had severe fevers. So after all of that was completed, they actually put me on Solaris for my PNH. And then for that, I had had some back pain associated with that treatment. Again, just fatigue and some headaches and things like that to go along with just not feeling right. I had also experienced some brain fog as well, and I still do to this day. I'm on a different medication now called Ultomiris, and it's kind of a newer drug for PNH, and so I still sometimes do get brain fog from that as well. So what was the second part of the question? I'm sorry.
Just how, which one of those most significantly impacted what you were going through at the time or even now?
Yeah, and actually even about a month ago, to add on to that, I was recently in the hospital with Neisseria meningitis, which, you know, having what I have, you're actually vaccinated for that. So it's very rare to actually get meningitis, but I actually got it during this time of COVID, thinking, oh, well, maybe I just have COVID. And so that was another complication. And I had developed a rash, and I didn't know what was happening. And so thankfully I'm still here, and I don't have, you know, any brain damage, because the doctors were saying, oh, well, just a few hours later, it could have been a completely different story, because it attacks your whole system.
Wow.
So that's something serious too.
Yeah.
That I would say to also stay on top of your vaccinations. You know, that's a really important thing as well, especially when you're immunocompromised.
Yeah, those infections can happen throughout your entire treatment. That's very frightening.
Yeah.
To be able to get that sick. Mario, what about you?
Yeah, so basically what Sarah's saying, initially was the side effects that I encountered were the fatigue. Unfortunately, the bruising, Lee knows this story and them at the foundation, the bruising was pretty relevant, but also because prior to being diagnosed, I was actually like sparring, like martial arts sparring. So the day after, when I developed these big purple bruises, I'm thinking this is from just not working on my defense, you know? So that was, it's funny now in hindsight, but it wasn't then. Big purple bruises, the bleeding. Actually, I was also scheduled, ironically enough, for a routine dental filling. So when I got the injection of Novocaine, hence the bleeding started to happen. So so all these things started happening. This is all pre-diagnosis. But the fatigue prior to, the fatigue post-diagnosis, the serum sickness was another side effect. And in terms of the medications that I was taking to deal with not just the aplastic anemia, I also had to take a lot of medications to deal with the side effects from some of the medications I was taking. And to answer the second part of that question, Dr. Thomas, for me, the worst part was the serum sickness, other than the aspergillosis, but that, like the serum sickness to me, just radiates.
Yeah, completely agree.
Yeah.
Yeah. And it is so difficult when we're giving you meds to then deal with the side effects of the meds, to deal with the side effect of the meds. And it can end up being this kind of just cycle of craziness.
Yeah, like for me, my doctor has me on a regimen of penicillin because of the meningitis as a preventative. So it's kind of interesting because I don't really know the long-term side effects of being on penicillin basically for several years. Now I'm on it twice a day. So it's interesting that, you know, I don't have a choice in the matter, obviously, but I don't know what that could potentially do to my body down the road also.
So you guys have both talked about symptoms that you've experienced, and I know you said that you were, I don't remember, did you say you were currently in school, Sarah, or you
So I actually graduated right before I was diagnosed, basically.
Okay.
So thankfully I was able to get my degree right before.
Yeah. So are you guys currently working, and have those symptoms affected working, and have your jobs been accommodating to any of those symptoms by, I don't know, like different types of accommodations, like extra breaks or anything like that? Because you guys have talked about fatigue.
Mm-hmm. So right now for myself, I'm actually on unemployment. I'm not working at the moment. And because of what just happened, I'm not really in a huge rush to go back, to go back out in the lion's den there. But so before all this, I was ready to start my career, and I got so sick at the time that I was unable to kind of get that going. And then I was sick for, you know, a few years. I had spent many days and nights in bed where I couldn't work at the time, you know, and mentally I wasn't capable of that either. And then actually my last job, which was last year, I got fired because I was on a medical leave because of a procedure that I had. And so they actually, which I know is actually illegal, they fired me because I wasn't ready to come back on a certain date. And I said, I'm so sorry, but I can't do this. And they said, I'm sorry, but we're going to have to let you go. So right now I'm on unemployment, and that's another challenge of being sick is, you know, having someone giving you a chance, but also being accommodating as far as, hey, you know, there are days where I'm not going to feel okay, or I might need a sick day. And so it's hard to find an employer who you don't know. For my sake, like in an interview, how much do you disclose to someone, how vulnerable? Yeah. So there's several layers of difficulty as far as someone like myself who needs to get into a job who hasn't already been at a job. So.
Mm-hmm. Thank you for sharing that. Mary, do you have any additional comments to that? Because it's so important for people to hear about those different aspects of working and disclosure in the workplace.
Yeah. So currently I am working. I'm actually, and again, I know I'm fortunate. I am very fortunate where, you know, my CBCs are within normal range. I have minimal to zero kind of lingering effects of aplastic anemia. But when I was initially diagnosed, I was in between projects. I was doing consulting work. I have an IT background. Like Sarah was saying, well, when I got sick, unfortunately, I'm trying to recall now. I was already filed for unemployment because I was in between projects. But in the interim of my recovery, I just couldn't go back to work. It was just for the exposure aspect of it. And like I said, I was doing more consulting work, so it wasn't like I had a situated place where I was familiar with it, not to mention the side effects, what I would have to deal with if I did go back to work, dealing with fatigue, dealing with being cautious of the environment I'm working in. So ultimately, I didn't go back to work until probably 5 years post-diagnosis, but in the interim, I was able to qualify for disability, and it also gave me the opportunity, which I'm actually grateful for, was I was able to stay home with the boys for the first 2.5 years and, you know, raise them. And then when I felt better, having discussions with my medical group, with Allison and whom, you know, the people surrounding me, that's when I decided to get back in the workforce. But it was hard, you know, because at that time too, it was still dealing with more of the side effects that, you know, that were still lingering opposed to now. But, you know, that's where I'm at. And like I said, now I'm lucky. I'm able to work and I have minimal to zero repercussions of the disease, but I'm still conscious of it.
Sure.
Yeah, both of you mentioned that the lingering side effects that you've had, and Mari, you mentioned your kids, which is always fun to hear about and exciting. We were just wondering, prior to starting your treatment, did you discuss those like long-term side effects with your healthcare team? And specifically, did you talk about potential fertility or potential problems with fertility later on in life?
Yeah, so for me, my doctor at the time, I had actually switched doctors because she wasn't a right fit for me personally. And that's another thing too that's important, that if you find a doctor that you're just not communicating well with, I think that's important to find someone that understands you and you can get along with, as well as, you know, is obviously, I can't think of the word, but so.
That relationship is important, you know, like you need to be comfortable, right?
Yes, yeah. So my first doctor, she said, oh yeah, the side effects it's no walk in the park, is what she said. And that's, to me, that was a gross understatement in my opinion. But So, I mean, I heard my doctor say, you know, these are the side effects, but in all reality, I wasn't able to really comprehend what they were saying. I mean, I was kind of just going through the motions, honestly, when I was sitting there as a patient hearing this for the first time. You know, you have to conceptualize, you know, oh my gosh, I'm really sitting here, I'm this patient, and they're talking about me right now. And so, you know, you hear a doctor talk about side effects, but you're not really getting it until you're in the hospital getting that treatment, and you're thinking, oh yeah, this is what they're talking about. So for me, it was kind of, I didn't really feel the side effects and really understand until I was actually getting the treatment. Again, like, to me, it just felt like words, you know, someone saying, you're going to go through this. Well, I didn't really understand the depths of it until I was sitting there actually experiencing it.
Yeah, 100%. I agree. You know, you don't really know what's going to happen until it happens. But fortunately for me, I have a great medical team. You know, just a few doctors at my local spot have transitioned, but I'm even very fortunate to transition, because I agree with you, Sarah. You have to be comfortable with your team. You have to be able to talk about anything. And then, you know, not only is my New Jersey team great, I'm fortunate enough to be treated at NIH by Dr. Young and his group. So it doesn't get much better than that. They shoot from the hip. We're very comfortable working with them and ask them any questions. You know, it's a conversation is what we have. I joke around sometimes. It feels like it's almost like Jedi mind tricking sometimes, because it's sometimes, well, what do you want to do? And then I come back with certain things, well, I'd like to, and then it's kind of like, well, okay. I'm like, did that just really work? And I mean, we're talking on a professional level, but it's just that's how comfortable it is. So that's kind of addressing the side effects. The fertility part, actually, when I was diagnosed, Allison was just my girlfriend at the time. So fast forward about 3 years after that, we were able to get married. And of course, our trips to NIH were more frequent back then, as you can imagine. It was every 3 months. So the question about starting a family, and I was 38 when I was diagnosed. So you know, it was, if we wanted to pursue that, it would have to happen sooner than later. Well, of course, because I have my 2 boys, we were lucky that things worked out the way they did, but that was most definitely a concern for us. Hence the chromosome testing that was done, you know, just to test everything from beginning to end on all levels. And those are definitely the questions we asked. Like I said, you know, just I sound like a broken record, but I was very lucky, because just having this medical condition, strike one, you know, and then you can just input a bunch of other factors there, but definitely a concern. And, you know, like Sarah was saying, feel comfortable with your medical team. I had no problems asking these questions. I have no problems asking any questions, but, you know.
Right. Yeah, and I actually, I'm sorry, I forgot to answer the question, the fertility part for myself. I'm sorry. So that actually was a discussion for me as well, with my current doctor, who I love, Dr. Versalati, from the U of M. And he basically sat me down and said, Sarah, you know, when that time comes, we'll have to have a more serious discussion. At the time when I was diagnosed, I was dating someone, but that did not work out. So in the future, I kind of get the feeling that he doesn't want me to necessarily go through a pregnancy myself because of me being high risk, and what that would potentially do to my body. I know it is a high risk, and it comes down to, like Mario is saying, you know, your team and what you decide is right for you at the time. So I guess that was a scary thing for me to hear. And this was like a few years ago, when probably about halfway, like maybe about 3 years ago, was when we had this discussion. And I couldn't believe that they were talking about myself, and you kind of think, well, getting pregnant, you know, how hard is that? Or, you know, because you expect that you just, you know, you want a family. Most people can get a family. So now I have to think about that. And for myself, I have to find a partner accepting of me being sick and having this condition. So that's another challenge as well.
I'm so sorry, Sarah. That's just, it's so difficult to have to go through that, and
Yeah.
like you said, it's been an ongoing thing too.
But you know, the good thing is I think when I find that person, I will know, you know, what kind of person, what kind of man they really are. If they're willing to step up to the plate and really, I mean, that says something about someone who's willing to stick by you. And so I know when I find that person, it will be right. Yeah. So
You're absolutely right.
thank you.
So we've talked a lot about the symptoms, and has this affected your self-image at all, or just how have you coped with this? And did you have to reach out to any additional supports besides family and friends? Did you call on mental health professionals at all? Was it helpful? Anything like that?
Sure. I don't know what happened to the screen there. But so for my self-image, I would say before I got sick, I was a pretty confident person. You know, I had graduated from school, you know, again, ready to start my career. And when this hit, it hit really hard for me. And again, with all of the medications, I had several side effects, one of which being I was on pretty heavy doses of prednisone, which had made me, my whole image change. You know, my cheeks had gotten much bigger. You know, I had a bunch of water weight when I was in the hospital, so everything was like swollen. And so again, and I think just the pressure that society puts on ourselves now about how we're so fixated on image, you know, that was something that I had to come head on with. And luckily I was able to find a mental health therapist to kind of, after these intense treatments, to really help me process what was happening, and really articulate kind of a plan going forward. And then also having this rare disease, it really shows you, you know, who's your family, who's your real family, who's your real friends. Sometimes it's people that you don't expect that will show up for you. Sometimes the people that you think will be there for you are not there. I mean, people get kind of funny with illness, especially as a young person, because they're so used to, you know, maybe a 75-year-old who gets something down the road, but they're not used to their friend being so sick with something so serious. So that's something as well that patients will find out is, you know, who do I share this sensitive information with, and who can I trust with this? And sometimes family members don't know how to be there for you or what to say. And, you know, I've had to be okay with that.
Yeah, we talked about having tough skin, right, Sarah?
Yeah.
For me to answer those two questions, the self-image part, fortunately for me, I had these long flowing locks prior to aplastic anemia. So my hair regimen kind of stayed apart, of course. Actually, they would question that because I would shave my head, you know, is this a repercussion of any of this? No. What actually, and I have this is a birthmark. I've had it since birth. That was another concern with them. And just to let you know, actually, I'm thinking about it as I'm speaking freely now. because growing up with this birthmark, and you know, I was from the Bronx, New York to New Jersey. Kids were kids. We just, you just gave it, you take it, you gave it back. So we always, my skin was basically tough. The self-image part, you know, I wanted to get better. So in terms of that, I was able to cope with that. Like I said, I was already shaving my head. The cyclosporin, one of the side effects, is anyone having that will allude to, is the hair growth. So I was excited. I was like, all right, here we go. Of course, didn't work out.
And I was not excited.
It grew in all the wrong areas. So that, you know, but I think that's important. I think that's important for, you know, for people to seriously consider. And it's an individual approach to that. Me to answer that question, I wanted to get better. The self-image, listen, you know, it was what it was. In terms of support, and I'm fortunate for this, and Lee and the group have heard me say this a million times, the first resource that we reached out to was the foundation, and it was a blessing, because a million people will tell you with anything, if you Google anything, like you can, you know, it'll blow your mind. You're on it's doom and gloom. So the foundation was able to direct Allison and myself to the proper resources, and the other support that I reached out to while I was being hospitalized was I took advantage of the social workers. And like I said, I was fortunate. I had some great social workers here in New Jersey, over at NIH, and family and friends. Exactly what Sarah said. You kind of have to find the one. I pick my spots with what I share with people, and it's not a bad thing. It's just like you're saying, some people can kind of, whatever their reaction is, I kind of gauge it by that. And one of the patients here in New Jersey runs a monthly support group that I like to participate in, because I think it's just as important, not so much for me, but to give what I can to whatever members are there, whatever questions they have, because prior to being diagnosed, I knew nothing about this disease. Trying to find out information about it, you find out how rare and uncommon it is. Attending my first conference was really my like breath of fresh air to say, oh, I don't have to go through my introduction and this 20-minute spiel about what this is. You can just talk freely to people, kind of what this, you know, so I'm grateful for that. And I think that's why it's important to find, or whatever coping method to deal with. I think that's important, but you got to find what works for you. That basically what works with me.
Mm-hmm.
We do have a question from the audience. Mario, it's directed to you, but Sarah, please feel free to pitch in too, because you've mentioned some of this. And Mario, you were just saying that, you know, at the beginning, you were just like, let's get through this. Let's get the best treatment. Let's do the things. This question is, how many trials have you been on? And you said you're 13 years out. So how long do trials usually last? Could you guys, both of you, talk a little bit about maybe the clinical trial process, or maybe getting on some of those new medications that you were on, Sarah, and how that went down?
So basically, the local group that I was dealing with, I think they had one aplastic anemia patient in the past. So they enrolled me, or applied me for the clinical trial for, and it was up in the air, the treatment I was going to receive at NIH. Fortunately, I received horse ATG. That worked well for me, you know, barring the serum signature, which unfortunately is to be expected. I'm sorry, doctor, what was the gist of the question there about, the clinical? So basically that lasted 10 years. When my 10 years were up, I actually re-enrolled for the clinical trial, because I just felt it's my obligation to re-enroll in, and if, you know, whatever I can do and whatever data I can provide. So even though I shudder to think about the bone marrow biopsies, which is not my favorite part, I think it's my obligation to do so, because, you know, this is such a rare and you know, uncharted ground with this disease. We just don't know enough about it. So, but you know, like I said, that's where I'm at right now. Actually, unfortunately, I was supposed to be there this past week, but because of the whole, not my situation, but because of the COVID situation, and because my recovery is, you know, robust in the equivalent to a remission, we're gonna bypass this year so that we can keep everything open for the people who really need the treatment. So I'll be going back next year, and like I said, I'm gonna keep re-enrolling as long as they'll have me, until Olga and Dr. Young say you have to get out of here now.
Yeah, and for me, I was never enrolled in any actually clinical trials. When I was diagnosed, they had already had eculizumab. Solaris is the other name for it, and that was basically, it's either this, or if you're sick enough, you get the full bone marrow transplant, which when I was first diagnosed, I was kind of headed down that direction. I had had a BMT consult actually initially when I was first diagnosed back in 2014. So, and then I was on Solaris, and then I did seek a second opinion. I did go to the University of Utah just to make sure that this is the right course for me, just to double check, because I think that's always a good thing to do, to have well, at least a couple of opinions. And I saw Dr. Parker, which he's a very good PNH specialist there. So he confirmed that, Solaris was the right thing to do. And he thought also that at the time that I didn't need a full BMT. And then when Ultomiris came around, that's another newer treatment that's been around for, I would say, a little bit more than I would say about 2 years. So I was relatively new for that drug, and so he had said, as long as you've been out of the hospital for, I think it was like a year, that we're going to go ahead and try this. What do you think about that? So him and I had a long discussion about side effects and the differences of, so Solaris is every 2 weeks, and then Ultomiris is actually clinically every 8 weeks, but I go every 7 because I feel better when I get it every 7 weeks. So, I haven't actually been in any clinical trials, but not to say that I wouldn't ever do that. I'm open to definitely different roads, because obviously everything is ever changing. So, yeah.
I think we have a few minutes left, and Sarah, you already touched on this. Actually, both of you touched on this. And from a physician standpoint, at least my goal is that with my patients, we have shared decision making, where like we're having that conversation, like Mario said, and we're able to really to come up with treatment plans that really make sense for you and your families, and kind of what's going on in your lives. I know, Sarah, you talked about how you switched doctors, because that doesn't seem to have been the case. Can you guys both touch on maybe what healthcare providers can do to better support you and better make that a reality that we're kind of all striving for?
Sure. Do you want me to go? Do you want me to go first?
Absolutely.
Okay. All right. So one of the things I would say to kind of make things more collaborative from a physician standpoint is when I had my first doctor, it was all about the numbers, right? So she would sit down, look at the computer screen and tell me all these lists of numbers. And I didn't understand what that meant. She would just rattle off letters and numbers, and but we didn't really, and honestly, I feel like she barely looked at me either. So it's really important to establish eye contact, get to know your patient outside of their disease, because we were people well before we came into their office, right? So it's important to see that full picture of who someone is. And that's what I was missing with my previous doctor, was there really wasn't a relationship. It was really more one-sided, where she would tell me numbers and I felt like it was very, very mechanical. So I would just encourage anyone to really try to put yourself in a patient's, from a patient's point of view, because we didn't ask for any of this. We didn't bring it on ourselves, and just to be acknowledged that we're people too, and I don't know, just start from there. And there's different personalities, obviously, but hopefully everyone can be as blessed to find, that working relationship, as far as you have that caring ability, you have that empathy, but you also have a doctor who is, hella intelligent and just has their shit together. I'm sorry to, but and that's the best of both worlds. So, but I would encourage patients to, if it doesn't feel right to you, that it's important. I mean, this is your future, that, going forward, it's important to find someone that works for you.
Yeah, I agree 100%. You actually, Sarah, I agree. The one word I wrote down that you alluded to was collaborative. I think it should be a collaborative approach. Now, what I mean by that is I'm not going to diagnose myself and prescribe my treatment regimen, but I think that the collaboration is important. Remaining engaged. I think that, like Sarah was saying, I'm okay with you telling me what to do, but on the same token, if you ask questions, when I go see some of my doctors, it's, hey, how are you feeling? What's going on? It's it's having the conversation, it's being relaxed, and having the ability to ask questions. And then, in terms of second opinions and things of that nature, again, I gotta break my own arm, pat my back. My medical team, it did nothing but encourage me to do so. I mean, we're talking from some of the top of the line here, where they're like, no, by all means, So that to me is very comforting. And see, with me, my approach is, I'm more of a bottom line person. Just break it down, give me a bottom line, and then of course you have to explain it to me like I'm 5 years old. Just give it to me in the simplistic terms, because I can't process some of this lingo. I just need to know what it is you need me to do. I'm going to do that, and just break it down and explain it to me like I'm 5, because I'm probably going to listen to you while I'm watching something on YouTube at the same time, So, but yeah, I think that's important. The engagement and the collaboration, in my opinion.
Yeah. I think we're at our time. I never know. I don't know if Julie wants to pop back on, or Lee. We do have one more audience questions, and I'm not sure if we can get to it.
Let's go right ahead.
Okay, perfect. Thanks, Lee. Our final audience question was, how do you deal with the anxiety of living with aplastic?
Ladies first.
Okay, let's see. Well, I would say I deal with it, a day at a time, because there are days where I feel pretty good, and I don't feel super anxious, or, with depression too. I have my days of feeling down, so that's a part of it as well. So I try to, wake up each day with kind of a renewed sense of self, and try to start the day off positively, and go from there. Because if I think about the bigger picture, for me, I just can't do that, especially, living in COVID times. I think a lot of us are just going day by day to see what's going to happen. And so that's what's really helped me. And then also finding those people in your circle who you can trust, who you can really, if you're having a bad day, you need to know who those people are that you can reach out to, who will actually listen to you and not minimalize it, not make you feel bad for anything, and just be supportive, because that's huge. That's a lot of it. Just to be able to get that off of your chest and say, hey, I'm having a bad day, or I need to cry about this right now. And, and sometimes I cry without warning, sometimes I just you know, I'm just having a bad morning, so I'll just cry, you know, and I feel better afterwards. Or if you have a therapist, that's important too. If you feel like having a mental health therapist is the right fit for you. So there's several different ways to kind of deal with it. But I would also say, for me at least, it's not an everyday occurrence. And that's important too, because if you think of it that way, it can be extremely overwhelming. And it's the same way with depression too.
Yeah, well said. In terms of what you said, I was, prior to treatment, kind of a moment by moment person. Being diagnosed with aplastic anemia taught me to be that way. One thing that I had to learn was to be more accepting, I should say, of just things being the way they are. That when I did feel anxious, and that was, you know, it's just part of, for me, it was part of the process. I would just accept it, do my best to kind of break it down. I wouldn't try to poo-poo it like it's not there. I would just try to kind of see what exactly was happening. And you also alluded to, Sarah, like finding not only your group and your team, which is most definitely important, but doing what you can by finding comfort in the things you enjoy doing. And that's whatever it is, as long as it's well within the realm of you remaining healthy. And then these times now being a little bit more uncertain and more challenging, you know, that goes with the acceptance for me of just accepting the way things are, but controlling. I would just break it down by controlling my piece, what I can, you know, what part of all this can I control, and not so much everything that was happening, but kind of my reaction to it. I knew that's what I could control as best as I could. And I mean, that holds true currently. So I try to really live by that.
Thank you guys so much for being willing to do the panel today and being vulnerable and sharing your experiences and answering questions and just being here today. So I really appreciate it. And
My pleasure. Thank you for
you
having us.
so much.
Ditto to Taylor. Thank you guys so much. It's good to meet you guys.
Thank you so much, Dr. Thomas and Taylor and Sarah and Mario, for joining us today, sharing your expertise with all of us today. It's very much appreciated. It takes a lot for patients to open up and talk about their experiences, and the things that you share are so invaluable to be able to help others. So thank you so much, Sarah and Mario, for being so candid and sharing with all of us today. If you would like to watch this program, the session again at a later time, it will be available on our website within 2 to 3 business days. If we were not able to get to your question, or you'd like to ask something else, please send it to us at any time in 3 ways. Send an email at help@aamds.org. You can call our helpline at 800-747-2820, extension 2, or submit your question on our Facebook page. This conference session is going to end. You will need to rejoin the conference using the same Zoom link or call-in number provided in your conference reminder email. On behalf of the Aplastic Anemia and MDS International Foundation, thank you for joining us today and making us your resource of choice for information on bone marrow failure diseases. The AAMDSIF Medical Advisory Board and team are here to support you and your family, as we have done for the past 36 years. This concludes the session. Thank you guys again.